Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn let me now tell you a story. It was given in AIMS PG 2017. Past question. A patient with diabetes mellitus, history of pancreatitis, family history of urinary bladder carcinoma, and allergic to sulfonylureas. And not want to take injectables drugs. So what is the treatment? Okay, there are 4 options which were given. One, liraglutide, then sitagliptin, then canagliflozin, then glipizide. Okay, so if you see liraglutide is a GLP analog. Okay, and it should be given only subcutaneously, so we won't give it because the patient is not willing to take injectable drugs. Then if you see sitagliptin, it is actually DPP4 inhibitor and it increases the risk of pancreatitis. Here the patient already has pancreatitis, so we won't give this. And then if you see the drug, then glipizide. Glipizide is actually a sulfonylurea. So patient is allergic to sulfonylurea, we won't give it. And one more drug which is also there in the option is pioglitazone. Pioglitazone, it increases the urinary bladder cancer. So obviously the patient has family history, so we won't use it. So the drug here is canagliflozin. Thank you for watching.
Thank you and thank you for watching.